Good morning or good evening, and welcome to my presentation for ICoP on how do nurses and midwives advocate for planetary health policy in a people-centred healthcare system. I'd like to start with a quick overview of the presentation, and we will look at planetary health and climate change crisis, global policy positions on both people-centred health systems and person-centred practice, global policy positions on planetary health, and how do these two positions fit together and why are they important to advocate for policy change. And finally, I will finish with some examples from the field of practice. So there is no doubt that climate change presents a huge threat to human existence, with the WHO saying that climate change presents a fundamental threat to human health. The United Nations say that health and climate change are inextricably linked, and the health of billions of people are endangered. And UNICEF take a similar approach when talking about the impact of climate change on children. And on this slide, we can see some distressing pictures, which are all too familiar to all of us, regardless now of what part of the world we live in. The reality really is upon us now. It's not something that's happening in the future. And you can see that the temperatures in the UK and Ireland are heating up. And it's not uncommon now in the summer in London to have temperatures of 40 degrees plus, which are causing problems for the health system. And forest fires, smog, barren land, and indeed many floods are causing people to be displaced from their homes, impact on the delivery of healthcare services, and put lives at risk. And unfortunately, the picture is even worse in other parts of the world, with more distressing images here of Canadian wildfires. We will remember the Californian fires, mudslides, impacting on flora, fauna, and animal wildlife, which is required for our existence. So I think it's clear to say that climate change is in fact impacting on all of us and is a significant risk to our health. I think it's also fair to say that we, as guardians of our planet, and have to take some responsibility for our own behaviour, which is driving the problem, specifically driving the behaviour because of our use of fossil fuels and the emission of greenhouse gases, which is one of the main contributors to the problem of climate change. We also see rising temperatures. Average global temperatures have risen very sharply, resulting in more frequent and severe extreme weather events worldwide. And you can see the graph to my right, which demonstrates the heating up of the planet quite significantly above the 1.5 degrees, which is a rise above the pre-industrial level. And that 1.5 degree rise is considered to be a fundamental shift. And for many, they would say that retraction from the damage that has been caused is irreparable at that point. And of course, this threatens our ecosystems, it's melting our polar ice, and rising sea levels are endangering many coastal communities who are having to be displaced from their homes and their communities and their way of life and indeed employment. I think we should take a minute to think about the impacts of climate change on human health, some of which are very visible and some of which are invisible. And in terms of mental health, which is one of the less visible ones, if you can imagine not being able to provide for your family, maybe not having a safe place to shelter, a roof over your head, ability to provide food for your children, not having work, no access to food, unable to wash, etc., you can see that that would have a significant impact on anybody's mental health. And this leads to stress, anxiety, depression, a sense of loss, even post-traumatic stress disorder for some people, and puts strains on relationships. And then on top of that, we have the physical signs and the impact of human health on things, for example, like air pollution causing asthma, cardiovascular disease, extreme heat, leading to death sometimes, and cardiovascular failure, drought and a lack of water supply, changes to the environment which force mitigation, loss of jobs or income, wildfires and smoke, again causing cardiovascular respiratory disease, and a degree of injury and fatality, and sometimes loss of home. Living conditions and social inequities are often exacerbated, particularly in racial and groups that are already have bigger health inequities and vulnerabilities. The ecosystem, the vector ecosystem is changing with new forms of malaria, Lyme disease now prevalent, and West Nile virus also having prevalence. Food systems are impacted, often leading to malnutrition, food insecurities, higher food prices, and foodborne illnesses that we haven't seen for quite some time. Severe weather and floods causing injury, fatality, and damage to homes, and the water quality often being impacted by harmful algae blooms in our water reservoirs. And when we talk about climate change, I think it's important for us to take a broader outlook, certainly from a health policy perspective in terms of planetary health, which is a deeper and wider connection with our planet, and for us to be responsible for how we treat and manage our planet. The fundamentals of life and well-being are deeply interconnected with the natural world, and healthy people, individuals and families and communities all depend on the ecosystems that we live in for us to function effectively. And when our ecosystems thrive, they provide the necessary conditions for good human health. Conversely, then, disruptions in that natural system can become a negative impact on the well-being of people and of societies. So understanding planetary health is really important, and traditionally medicine and medical science has focused on the human internal systems of the human body. But the concept of planetary health expands this perspective significantly. It emphasizes the importance of considering the external systems such as environmental and ecological factors that either support or threaten our ability to live well on the planet. And by broadening the scope of health research to include these external systems, planetary health aims to address the complex challenges posed by environmental challenge and change. In terms of planetary health and nursing, I see this as potentially a specialism of its own in the future. And one of my colleagues, William Rosa, defines planetary health nursing as a field that recognises humanity's interconnectedness with the stability of the planet. And this approach highlights the grassroots efforts of nurses around the world, as well as other professions, and their commitment to making planetary health an absolute priority. Nurses serve as facilitators of healing, as leaders and advocates for well-being, social justice and health equity. And through our work, we embrace the responsibilities to promote planetary health as an essential component of our role. So having provided a policy context for climate change and planetary health, I'd like now to focus on a policy position on person-centred practice and people-centred health systems. And the first is from the WHO, who have had a global strategy on integrated people-centred health services since 2016. So it's nearly 10 years old now. So nothing new really. And this policy has become increasingly important as we change our health systems and move care closer to home into communities, and focus on the complexity of healthcare, long-term conditions and health inequity. And the ICN have provided a new definition of nursing, which recognises nursing as a profession dedicated to upholding everyone's right to enjoy the highest attainable standard of health through a shared commitment to providing a collaborative, culturally safe, people-centred care and services. The definition is actually quite longer than that, but for the purposes of this presentation, I think it's important to reference the people-centred care and services. And then we have a model of person-centred nursing from our academic colleagues, Professor Tanya McCants and Professor Brendan McCormick, which is now recognised as a mid-range theory, and there have been several papers written about the effectiveness of the interventions in using this model for nursing practice. And in fact, the authors have gone on to provide an additional model of person-centred practice, which enables us to look at a broader context of people-centred health systems and multidisciplinary working. So I have borrowed this slide from Professor McCants at Ulster University, and the model of person-centred practice is underpinned by an understanding of humanistic caring. So I want to briefly describe how this model can be used directly in health systems to advocate for policy change at any level in relation to planetary health. And as you may know, the model works from the outside in with 4 domains. The first is the prerequisites, which describes the attributes of staff. and that would be considered the building blocks of staff development. So when we think about planetary health and climate change, we can relate this directly to the amount of education and training and support that's available for staff in relation to dealing with this particular issue, and I will come back to that later on in the presentation. And moving into the practice environment, this reflects the context of care and the complexity of the issues that we're facing in relation to planetary health and the magnitude of the disasters, as I illustrated earlier in the presentation. And the person-centered processes focus on how we connect with people, and in this case, the connection with not just people, but with our planet and planetary health and that interconnectedness that I described earlier. And then at the heart of the model, at the centre of what's called the flower, we have the person-centred outcomes and a healthful culture which enables human flourishing. But the question is, how can we flourish either at work or as people if we're not protecting our planet? And I've already drawn your attention to the impacts of climate change on health. And so to have healthy people on a sick planet simply cannot work. We cannot live on a planet that isn't being cared for and looked after. And you will see that the outer ring of this model is coloured grey, and it is a newer or fifth domain, which I think is what sets the model apart from others, because it allows us to think about the total healthcare system, about strategic issues, cultural or political issues, which may impact on our policy position and indeed drive us to advocate for further policy change. So I would like us to just think a little bit more about the macro context, specifically in terms of people-centred policymaking and the health and social care policies that are currently available, strategic frameworks, what's happening with the workforce and strategic leadership. So to start with the policy context and climate change, we have here the Sustainable Development Goals, which comes from the United Nations, the highest authority of global policy making in the world. And you will know there are 17 Sustainable Development Goals, with number 13 focused on climate action. But I think it's fair to say that climate action interconnects with many of the other Sustainable Development Goals. For example, clean water, healthy cities, innovation, life on land, life below water, and others. And I think it's also fair to say, when I reflect on nursing, that I can see nursing represented in all 17 Sustainable Development Goals, and therefore the opportunity to maximise our contribution as a profession to the delivery of Sustainable Development Goals and to planetary health is really illustrated in this slide. However, our progress on delivery of the Sustainable Development Goals is slow, and you can see on the scorecard here with less than 1/5 of the goals being on track to be delivered by 2030. And the UN Secretary General has said that we're just failing to deliver on the SDG promise. And this is the scorecard for 2024. And he says the take-home message is very simple. Our failure to secure peace, to confront climate change, and to boost international finance is undermining development. And we have to do better to deliver the Sustainable Development Goals. But more importantly, we have to do better to be able to survive as a population on our planet. And in this slide here, I'm just drawing your attention to the work of the WHO in relation to climate resilient health systems. And to note, for the first time in the State of the World's Nursing Report 2025, we have got recognition that government chief nursing officers have a critical role to play in ensuring that nurses in their countries help manage and mitigate population level health effects of climate change. And this is recognition that climate change is a growing area of policy work which nurses need to have a voice in and advocate for. So having considered a policy perspective for both person-centred practice and people-centred health systems and planetary health and climate change, the question is, how do they come together and why is it important for them to come together? So firstly, the interdependence between healthy people and healthy planet is now being recognised, as demonstrated in this presentation. The Lancet Countdown report has called for a people-centred approach. The person-centred practice framework that we've discussed aims to achieve a healthful culture. Our healthcare settings and systems are now provided in a whole range of different settings. And the physical practice setting extends way beyond hospitals now into more innovative and creative spaces, and indeed virtual and digital platforms. And a core domain of the person-centered practice framework that we discussed is the practice environment itself. So we also need to pay attention in how we care for the environments in which we are practicing, and how climate friendly we are in terms of the equipment that we use, the heating, the lighting, and the food that we provide to people, because ultimately the healthy physical environment is needed for healthful cultures and a healthy society. And when we think about advocating for policy change in relation to planetary health and climate change, this also extends in a people-centred health system to our staff. And this rapid review completed in 2024 highlighted the impact of climate change on the health workforce. And it will be no surprise to hear that staff shortages are exacerbated by climate change, because people are migrating to cooler climates. Disasters make it impossible for them to live there. They make availability of services difficult, and heat stress makes it difficult to do your job. We also see that task shifting during acute events and natural disasters is becoming more and more prevalent, particularly in nursing, where staff have to deal with the crisis as it unfolds and do whatever job is needed to be done in order to support life. Staff are also now much more inclined to act as first responder roles, and this is an increased burden on them in a health workforce that already carries significant emotional burden, and still dealing with the impacts of COVID-19. They have this additional burden. So occupational health are saying people present with mental issues with mental well-being, anxiety, burnout, and a lack of work-life balance. The review also highlighted a lack of training on disaster management and the inclusion of climate disasters in emergency planning, and the lack of leadership and nurse leadership to this area in terms of policy making while staff are actually dealing with the problem as it unfolds, demonstrates a disconnect between leadership and care delivery, and a source of frustration for staff. And if we had more time, we could map this very neatly to the person-centered practice framework. And I think it is, again, another example of how we can use that model in terms of policy for people-centered health systems. So what can we do to promote person-centeredness, planetary health within a nursing context? We can embed planetary health into all nursing models of person-centered practice. We can create person-centered healthful cultures and environments. We can do the right things first by focusing on prevention and early intervention. We can demonstrate effective resource stewardship, which supports lower carbon emissions. We can restore or enable or re-enable therapeutics, and we can advocate for evidence-based policy shifts that enable people-centered health systems to flourish. And so to finish my presentation, I wanted to share some examples from practice from strong nursing and midwifery leadership that has shown commitment to change for the betterment of people through reducing the carbon footprint and providing better person-centered care. These projects are nurse and midwifery led in the UK, and it's clear that the approach that they've taken is not only about carbon reduction, but about co-producing different pathways with people and communities. And they focus on meaningful outcomes for people. For example, the Continence Health and Wellbeing Project in the discovery phase identified that indwelling catheters, urine collection bags, and a prevalence of admissions for urinary tract infections, if dealt with differently in a different pathway, had the potential to reduce carbon by over 1,000 car trips around the world if it were rolled out in England. Not only is that better in terms of early intervention, but it's better for people in providing a better quality of life. Likewise, by optimising lower leg dressings and changing the nursing care pathway, evidence suggests a significant reduction in carbon and a cost saving of 4.5 million, significant wound healing time for patients on the diabetic foot pathway if this project was rolled out again in England. I've also included the web address where you can find some further information on the projects. And thank you for listening.